So we are ready to begin workshop 2 now, which is a practical guide to risk assessment. And Jeff is going to lead this session for us. So Jeff, you're very welcome and thank you for joining us today. Jeff has been an active health and safety rep since 1996, and he has produced a number of health and safety films for the union and was awarded the TUC Health and Safety Rep of the Year in 2009. He was the creator of the Valued Workers Scheme and presently chairs the Northwest Health and Safety Committee. So he's certainly Mr. Health and Safety, and any questions we have, I'm sure he'll be able to answer. And Wayne has said he will come in at the end as well with any questions. So just if this is your first session that you've joined, there is a question and answer box. If you can place your questions in it, and we will address those at the end of the session. So Jeff, thank you very much, and I'll pass over to you. Thank you.
Lovely, thank you very much. Thank you and welcome colleagues. As I said, my name is Jeff Smith. I'm the chair of the Northwest Regional Health and Safety Committee, and we're going to be looking at a practical guide to risk assessment. So the NASUWT has produced this guide to assist members in considering the steps that they need to be taken through the risk assessment process. The process applies to both the COVID-19 and business as usual circumstances. So I'm going to try and capture the two for you today. So this guide is intended to assist members and school leaders with the risk assessment process, but it should also be considered to be training, not to be considered to be training or to provide advice for any particular setting. The thing is all risk assessments must be adapted to the workplace for which it is designed. So if you could go to the next slide, please, Wayne, that'd be great. So the first question is, what is risk assessment? So put simply, it is a document that seeks to identify the hazards in a workplace and puts into place controls to eliminate or reduce the hazard. In terms of COVID-19, the hazard is presented by the virus and the controls are put in place to prevent it spreading around the school. There are many routes of possible transmission of the virus, and the risk assessment must consider those routes and how to reduce the likelihood of the virus transmitting via them. So a risk assessment will either be for the site, it'll be looking at the process and procedures which will work to reduce the risk, or individual, where the control measures should be aimed at reducing the personal risk, although there will be some overlap. So for example, the general risk assessment would state the general provisions that need to be taken in regard to social distancing, while the individual one could list groups the person will or will not be allowed to interact with, or if any. So it could say not to teach very young children or those with a probable behaviour issue, or a non-COVID example could be the general risk assessment around avoiding slips and trips, such as ensuring icy surfaces are treated, whilst the individual assessment could look at limiting outside movements. So really that kind of captures what is a risk assessment. So who is responsible for the risk assessment? The employer, or such as the education authority or the proprietor of a private school, will be responsible for the completion of risk assessments. So in complying or compiling a risk assessment, an employer must be able to consult with a competent person in the completion of the risk assessment, and the competent person can be employed by the employer, be the employer themselves, or be an external consultant. There is no requirement to have a competent person on the premises at all times. I think that's an important point to remember. The Health and Safety Executive Northern Ireland defines a competent person as someone who has sufficient training and experience or knowledge and other qualities. So in the case of the competent person, should have the skills necessary to adequately risk assess the situation. This is highly unlikely to be a senior teacher and will most likely require some form of formal qualification. Okay, so it should also be noted that generic risk assessments exist for schools to use. I mean, these are fine as a guide. However, they should clearly identify the parts that each school will need to complete. So remember, as each school is different, the risk assessments must be tailored to each workplace. In general, the generic assessment can state the measures that need to be adopted, but the school-based assessment would need to be clear on how these measures can be implemented. And I think that's an important point to remember when we're looking at generic risk assessments. The next point I think is important, that the NASUWT has received many requests to publish model risk assessments. However, by their very nature, risk assessments must be site or person specific. Okay, so therefore it's very difficult to produce a model assessment. There is also a danger that an employer will pick up a model risk assessment, attempt to implement it, and then, if things go wrong, attempt to use the fact that it was provided by the NASUWT as a defence, or even implicate the union. So we do, however, publish guidance on the completion of risk assessments, and all that material will be is held. It's my understanding it's held on the website. Okay, so I think we've covered that point. So could we go on to what is the legislative framework? So we've got the Health and Safety at Work Northern Ireland Order 1978 and the Management of Health and Safety at Work Regulations Northern Ireland 2000. So risk assessments are not optional extras or just good practice. They have a legal basis. So the Health and Safety at Work Northern Ireland Order 1978 is the basis for the health and safety system in Northern Ireland. So this piece of legislation states that an employer must do everything that is reasonably practicable to ensure that health and safety and welfare of its employees. And I think the other one there to remember is not just the health and safety, but the welfare aspect. So in a school setting, the term employees will also include pupils and volunteers. Okay, so the second piece of legislation is commonly referred to as the management regulations. The regulations formalised risk assessments as the basis for minimising hazards in the workplace. So under the management regulations, all potential hazards must be assessed and either eliminated or reduced as far as reasonably practicable. So the risk assessment should take place to prevent an incident, not because of one. So it's there as a preventative tool. So in the same way as an employer would not wait until a worker fell off a roof to assess the risks of working at height, an employer must not wait for an employee to become ill from COVID-19. No, before undertaking and implementing a risk assessment. So equally, an employer must not wait until an employee becomes ill with stress to do a general risk assessment. Far too many schools only do stress risk assessments when someone has become ill. And I think that's the big thing at the moment is staff well-being. But I'm not necessarily criticising the management teams as such, but I think the key thing is to risk assess, to audit, to find out about, particularly in situations of stress in the workplace, and then look to put control measures in place. Okay. So where employers employ more than 5 people, the risk assessments must be written down. Okay, this will apply in all schools and college environments. Okay. So next slide, please. Should consultation take place? I think this is a great quote. It says here, I find it hard to imagine how one could ever put in place an effective workplace health and safety system that did not include real participation and engagement of the workforce. Judith Hackett, HSE Chair. So time and time again, particularly as a role as a health and safety officer, we see policies developed and no consultation or lack of consultation takes place, or the policy is introduced and no training is given. That's why I think the reps, your job is so important to not to work with employers. The legislation should be a cooperative approach. It's in the benefit of everybody. I mean, no one goes to work to become ill. It should be that we work collectively to protect the health, safety, and welfare of everybody. So a cornerstone of the health and safety system is consultation with the workforce. This is made explicitly clear in various pieces of legislation, and it's not an optional extra. So employees should be consulted either directly or through a health and safety representative in good time on issues relating to their health, safety, and the results of risk assessments. So risk assessment should be shared with all relevant employees and be available at all times for employees to refer to. We will discuss consultation in more detail later in the presentation. Okay. So can we have the next slide, please? So how do I write a risk assessment? So in this section, we will look at the steps that should be taken when compiling a risk assessment. So what are the sections of a risk assessment? Next slide, please, Wayne. Thank you. So the first thing is we identify what can harm people in the workplace. Then we're identifying who might be harmed and how. Then we're evaluating the risks and deciding on the appropriate controls, taking into account the controls that are already in place. We're then recording the risk assessment and reviewing and updating the assessments. So each risk assessment will contain the same broad sections. First, the risk is identified, then the people who are at risk are identified along with how that harm may arise. So once the risks are identified, then controls are put in place to minimize this risk, and the outcomes are then recorded and shared. Okay, the risk assessment should then be regularly reviewed, and that is really important. Okay, particularly with COVID, we should be continually reviewing our practice and also reviewing the control measures, training, and information to the employers, to the employees, and making sure that safe systems of work, making sure how we move around the building, making sure the cleaning regime is kept in place, making sure that there is no complacency. That is why training is really important. I mean, in industry, they talk about toolbox talks, and similar to schools. In briefings, just reviewing the risk assessment gives the employees confidence. So, I think that's really, really important. If a variant changes, then people do get nervous, and that's why the risk assessment and training is important. So it must be stressed that the process should take place in consultation with the employees in the workplace, either directly or preferably through the health and safety representatives. Okay, and the representatives should be consulted on. And the reason that they should be consulted on is that, any employee should recognize that they are part of the team. They are the eyes and ears. They're an extra visual tool for the employer. They should be supported. They should be valued in terms of the work that they do. Okay, so we will now look at each one of these in turn. So how do I, could I go to the next slide, please? So what are the risks, considering practices and government guidance? So in general terms, this is about identifying any hazards that pose a risk to employees. And there are many, but each needs to be identified clearly. So in terms of COVID-19, identifying the risks will center around any practice or activity that could result in the transmission of the virus. So essentially, this will be around any direct or indirect interaction between people. So in non-COVID terms, this is anything that could reasonably, foreseeably pose a hazard. So some are obvious, such as slips and trips, or working from height, others less so. Some will apply to all schools, some to a very small number. For example, a school in England has recently been fined due to an inadequate risk assessment regarding animals on site after a child caught E. coli. The HSE provides extensive guidance on a large range of possible hazards. So the HSE will have all the guidance tools, how they can use the materials to support the employer making reasonable adjustments to control any risks or hazards in the workplace. Okay, who is at risk, please? Next slide. So who is at risk? So type of risk, location, other restrictions, severity versus likelihood. So once the risks have been identified, it is necessary to determine who is at risk and what the likely severity of that risk is. So certain activities will generate different risks for different people. For example, teachers will be at risk from COVID through direct interactions with pupils, whilst cleaners are more likely to be at risk through cleaning contaminated surfaces. A technology teacher will be more at risk from dust, etc., than an English teacher. A PE teacher is more likely to experience outdoor hazards than a music teacher, and so on. So an assessment should also be made of the severity of the hazard. Remember that different groups are impacted differently, which is very clear with COVID, but also applies to other hazards. So the other thing as well to build in as well is age, because age is always an issue to be considered, as the likelihood of an accident does increase with age, and workers over the age of 60 are much more likely to experience a significant or fatal accident. So there's an equality aspect there to the risk assessment. Okay, next slide, please. So what controls can be put in place? Does the task need to be done? Can the process be changed? Can safeguards be put in place? Should personal protective equipment be issued? So once we have identified the risks and those who are at risk, we need to put controls into place to reduce, or if possible, remove the hazard. So we'll look, what we can do is look through an example, say, the example I'm going to use is using wood in a technology room. So this should follow a hierarchy. So number one, we're doing the risk assessment. Is the task that is generating the risk necessary? Okay, can it be removed? If the school or college can operate without it, and it can be removed without creating additional hazards elsewhere, it should be. So using the technology example, there will be a need to cut wood, so the task is necessary. So that's the first thing. Number two, okay, if the task cannot be removed, then changing the process should be considered. Can the type of wood be changed to one that produces less dust? Can the machinery be changed or the wood cut in a different way to produce less dust? So number three, if the process cannot be changed, then safeguards should be put in place to protect people. In the technology rooms, can exhaust ventilation be installed to extract the dust as it is produced? And number four, only if the other measures cannot be enacted to control the risk should PPE be issued. It is a last resort. Okay, so no other mediations are available, then PPE could include things like masks, gloves, and aprons. So for the wood example, can dust masks be provided? It should also be remembered that PPE can give a false sense of security. So even if after PPE has been considered, the activity still poses a substantial hazard, it should be discontinued. So you're just looking at the hierarchy of risks. And just on that, in terms of wood, also in terms of risk assessment is the extraction of dust. So those extraction units would have to be checked on a regular basis and be part of the risk assessment. Okay, next slide, please. Let's have a quick sip, excuse me. So how should the assessment be recorded? So we look right down the assessment, consultation, amendment, final version, relevant employees, and then you have sign off. Okay, so the next stage is producing the risk assessment, recording the findings. So All employer risk assessments in schools and colleges must be written down. The assessment should now have identified the risk and controls and should be written in an acceptable format, such as the model assessment provided by the HSEN, or the HSE. So now is the time for the draft risk assessment to be shared with the employees and or the health and safety representatives for feedback. And that, in a way, is why, you know, we say that health and safety committees are a very, very, very helpful tool for employers, because they meet they meet on a regular basis, particularly in the situation with COVID, and any changes to any risk assessments or changes to risk assessments can go through that consultation process, and the health and safety representatives, you know, would be looking to support be part of that consultation process. Okay. Now is the time, as I said, for the draft risk assessment to be shared with the employees and all the health and safety representatives for feedback. This is a crucial step. This is really important, as in all employees will often notice deficiencies or better ways of controlling the risk, you know, from their experiences in the workplace. Okay, sometimes it's very frustrating. There is a perception of this idea of hierarchy. Consultation is critical in health and safety risk assessment, because as I say, you want to find out, you want to make sure that the risk assessment is fit for purpose. So consultation should be for a set amount of time, and will give sufficient time for employees to fully consider the assessment and respond accordingly. It should not be rushed by an arbitrary deadline. It should be consulted on and reasonable time given. So once the consultation period is finished, the final version can be produced, taking into account any suggestions from the health and safety representatives and or employees. It must then be published in an easily accessible format and shared with all relevant employees. So, for example, pupil risk assessment should be shared. Any amendments to COVID risk assessment should be shared. And again, going back to what I said earlier, it gives people confidence. It really does. So a relevant employee is an employee that may encounter the hazard. So for example, the slips and trips risk assessment would need to be shared with everyone in the building, whilst the COVID-19 risk assessment for providing personal care to pupils would need to be shared with those staff who deliver those tasks. So it goes back, in terms of, who does it affect? What control measures need to be put in place? And actually, if you look at the information, slips and trips is one of the biggest. Okay, and training is really, really important. Particularly making sure that if there is a slipping hazard, then it is reported immediately and controls put in place. Okay, so going back to the technology example, these would be shared with staff working in these areas, and non-technology staff should not be using the equipment or undertaking the practical work. Okay, so the risk assessments are specific. Some are specific for the areas or the individual. Others are more, I suppose, generic for the whole environment. So members should not be asked to sign off or agree the risk assessment, however. That's really important. There is no requirement to do so, and they must not do so. Employers and health and safety representatives are not health and safety professionals. Okay, they are giving feedback on the basis of their experience, etc. They are not responsible for any deficiencies that may subsequently arise in an employer's risk assessment, or any sign of process should be between the employer and their competent person. So like with the health and safety representatives, they're giving advice and feedback to the employer, but they're not signing off the risk assessment. That's not their job. That's the job of the employer, and that's very, very important. Okay, that they can give advice and give feedback, but the employer should be bringing in competent people. So, for example, a design tech room you would have. Say you're looking at the extractor fans, you wouldn't sign off the extractor fans. You would bring in a technician who would check the extractor fans, and they would sign that off. themselves because they've got the expertise to be, to do that job, and that would be forming part of the risk assessment. Okay, thank you. Next slide, please. How should it be reviewed? So regular, changes to working practices, changes to government advice, incidents, consultation, sharing. Okay, so all risk assessments should be regularly reviewed. Excuse me. The COVID-19 risk assessments will need to be reviewed on a regular basis, non-COVID ones on a regular basis, on a regular schedule. So if your school or college changes a working practice, then the assessment relating to this must be reviewed to ensure it is still fit for purpose. Okay, this would include any expanding provision. And then again, the Health and Safety Committee is a place where reps can sit, the employer can bring any amendments or any changes to working practices. The process then can be minuted. It can form part of the auditing process of the governing body. There would be a governor with a responsibility for health and safety, and that would also give confidence not just to the governing body, but also, to the parents and the wider community. So it's a good thing for everybody. It's really, really important. As I said to you before, sharing the information is critical because it gives people confidence. So government or HSE&I advice and legislation changes from time to time, and this will require a review of risk assessment to take into account new or amended advice. And whether the school buys back into the authority, health and safety, those advisors would be able to give advice to the lead person within the school responsible for risk assessment or the control of risk assessment across for the employer. So if an incident takes place, such as a COVID-19 outbreak or some kind of accident, then the relevant risk assessment should be reviewed. Okay, the risk assessment should learn from the experience of the schools, particularly if there is an incident, and employers should share details between schools. Okay, I mean, I'm a health and safety rep in my school, so we, with the risk assessments, we continually work with the employer. For example, the idea was to bring all the staff in initially. This is well over a year ago, but to do the training for staff, and we said, well, that doesn't sit well with us because we don't want to bring in large groups of people in. So we adapted it. We did virtual training. It's how we controlled the information, but also controlled the risk at source. So if you've got a team together and you've got, that's why reps are really helpful, because you've got the training. They form part of the conversation, and actually that development should be it should be collaborative. There shouldn't really be any trickies in conversations on health and safety. It's about working together. So once the risk assessment has been reviewed, there should be a period of consultation, irrespective of whether there has been any changes since the last review. Employers may have noticed deficiencies managers are unsure of. So once consultation is complete, it should be shared as previously discussed. There would be no need to stop the activity whilst the review is in place, as long as the existing risk assessment is fit for purpose. So unless advised to do so by the relevant authorities. Okay, next slide, please. So how do I consider a risk assessment compiled by someone else? So in this section, I think we'll look at how to consider risk assessments that have been compiled by someone else. So if the employer has put out the risk assessment for general consultation, then anyone can comment on the risk assessment. So if the employer is only consulting with the health and safety reps, which is perfectly permissible, this should only occur when the rep has received NASUWT training. Otherwise, they should decline and insist the assessment is put out to general consultation. And that's why I think it's important. It's why I always find it really bizarre to me when employers try and be difficult. It's not allowing reps to go out on training. It's just absolutely absurd to me. I mean, they can't do it, but it doesn't set us off on the best process. And why? You want the reps to be trained because they form part of the eyes and ears of the employer, and it should be, as I said to you before, the 1974 Act was an enabling act to allow consultation and practices of working together. So doing both consulting with the HSE health and safety rep and then the whole workforce is also perfectly permissible. But consultation, as I say, is the key. Okay, next slide, please. So what is the process? Similar to writing a risk assessment, hazards control and feedback. The process of considering a risk assessment compiled by someone else is similar to writing the assessment. So firstly, consider the activity that is causing the risk. Have all the possible hazards been identified? Can you spot any that have not been covered? If you are not familiar with the activity, speak to a colleague who is. It is often the process of discussing the assessment with others that spots the deficiencies. We had an issue a number of years ago about moving of broken glass from the science laboratory. And actually, when we talked to the technicians about the way to move the hazard, the issues we looked at what was the time frame, when could we move the hazard safely, how would the site control the hazard, because it was being done by the technicians. We went through all the process in terms of the risk assessments. We totally changed the process. The technicians were really happy about that. The control measures were put in place. The site team were able to take it out when the children were not there. So, that's how we worked through the process collectively, and everyone felt secure. All the training was given and the risk assessment was done. So, as I said, firstly, consider the activity that is causing the risk. Have all the possible hazards been identified? Can you spot any? Speak to colleagues. So once you are satisfied that all the risks have been correctly identified, consider the controls that have to be put in place. So following the hierarchy previously discussed, if possible, go through in your mind the activity and the proposed controls and decide whether they are reasonable, fit for purpose. If a control relies on PPE, consider whether there are any better ways of controlling the risk. Remember, PPE should be a last resort. Again, one of the things is particularly in schools, is putting up displays. So that's a classic where you could go through the risk assessments. Our members shouldn't be doing displays, but any individuals who are doing displays, there should be a proper risk assessment put in place. Working at heights, training, having the right supervision, looking at the process of if someone wants to display, how they request that, how it's done properly, and what control measures are put in place. Okay, so once you've checked the risk assessment, any deficiencies that have been noticed should be reported to the relevant manager. If this is during a process of consultation, then the feedback mechanisms should be made clear. If a health and safety committee is set up, then there should be an agreed process in terms of the Constitution, and that would be part of the process. And you take advice. The HSE has advice on the Constitution, how it should be formed, and that's a good way of recording and alleviate any trickies. So, if on the other hand you have noticed a deficiency in an existing risk assessment, you should not wait until the next review to voice your concerns. This should be welcomed by the school or college leaders, as anything that can improve a risk assessment helps to prevent incidents occurring. I mean, one of the things I've just recently done with an academy is working with the site manager, working with the head teacher. Actually, they were really supportive of getting reps, helping us to recruit representatives, because they recognize how good how important the reps were. And they actually encouraged people to step forward. It was really, really supportive, totally happy on them going on the training. And this actually academy that I was dealing with wanted one of their, said that, one of those would be one of their, one of their targets. It's a very, very supportive culture. because the business manager had come from industry and recognized the importance of good industrial relations. Okay, so so any feedback, whether during the consultation period or not, should be given in writing. Okay, so it's important to have a record of any feedback given, especially if it is not acted upon. So the rep, I would say as well, if you're going out and finding information just from an NASUWT's point of view, it's always good to just keep a note of it and record it. So remember, at all times, advice can be obtained from the NASUWT. Okay. All right, number 14. What if I have concerns? So assessments not in place, deficiencies, inaction. So NASUWT members often have concerns about risk assessments. These concerns usually fall into 3 categories. So number 1, there is a clear hazard, but no risk assessment in place. This is potentially a very serious situation, as if a serious incident occurs, the first thing that will be inspected will be the risk assessment. Okay, and the lack of one could result in prosecution. I make no bones about it. You know, we've seen prosecutions of employers. Okay, it's significant. So a missing risk assessment should be reported to the relevant manager immediately in writing, and that would go through the representative. But again, it's about helping the employer to protect the workforce. Okay, and any employer, in my view, who finds that difficult to have that response from an employee, in my opinion, that individual should be retrained. They should be retrained. Okay, they should go through a formal retraining as to, you know, changing their methodology, because ultimately that behaviour, in a sense, is a hazard in itself. Okay, number 2, there is a risk assessment in place, but it is deficient. This could be due to failing to identify all hazards, or through having inappropriate control measures in place. Again, where there are deficiencies, these should be reported to the relevant manager immediately in writing. Okay, and in a way, I say this to members when I'm dealing with these sorts with kind of poor practice, is that, you know, sometimes if the managers can't manage it, we have to manage the managers. So manage your managers. Okay, you know, if they can't do it, then manage the process yourself. That doesn't mean you take on that responsibility, but it's a way that you handle that tricky industrial issue. Okay, inaction, number 3, inaction. Concerns have been raised, but nothing is being done. In these circumstances, it is important to report the situation to your health and safety representative, or directly to the NASUWT. So in serious cases, a complaint may be required to the health and safety executive, but they should only be done in consultation with the NASUWT. So I'm the health and safety coordinator for Cheshire East. If it would come to me, I would try and deal with it through the authority or through that academy. If I had an issue which I felt was significant and the employer or the authority wasn't dealing with it, and I thought it was a significant risk because of the training that I had, I would be talking to the national executive. I would also be talking, you know, I've got that experience to be able to do that with a view to potentially moving it to the health and safety executive. Okay, but it's the hierarchy within the union. Seek advice, seek information, and, you know, we will support you in dealing with that problem. Don't do it alone. You know, even myself, I've been doing it since '96. I will go to Wayne. I'll have those conversations with him. I'll have those conversations with my national executive. If they don't know, they would seek legal advice themselves. So it's really important that you don't take that responsibility on your own. You know, just ask for help and ask for advice. Okay, next one, please. What are the penalties? Investigations, prosecutions. If any accident occurs, then an investigation may take place. So depending on the severity of the injuries or the occurrence, remember that an accident does not have to result in an injury to be subject to an investigation. Examples could be fires and explosions, asbestos, lack of asbestos management. An investigation to the health and safety failing will focus first on the risk assessments that are in place. So if there are flaws found in the risk assessments, or indeed the risk assessment is missing, this could lead to the Health and Safety Executive Northern Ireland serving a formal notice or a prosecution. And we've had them. We've had formal notices and prosecutions. We've had breaches of asbestos management regulations, and there have been significant prosecutions against those employers. And you're looking at potentially hundreds of thousands of pounds. So if the flaws have had previously been reported by the employees or the health and safety representatives, this is more likely to result in formal action being taken. So of course, a prosecution is little comfort if people have come to harm, but the prospect of a possible prosecution does sometimes help to focus the minds of the employers. So penalties for failing to risk assess can be severe. For example, Luton Borough Council has recently been fined £164,000 after a teacher was attacked by a pupil in the school. Okay, the pupil had a history of violence, yet the investigation by the HSE found that there were significant shortcomings in relation to the measures at school, and the council was found to have inadequate systems of oversight in the school. But that doesn't take away the impact on that teacher. You know, it's absolutely horrendous. You know, I'm sure that, you know, it would have been far better to have that control measure in place. That's what's really important. Okay, we shouldn't be going to that stage. Okay, next one, please. So risk assessment process and records. What about classroom activities? So all activities, okay, in classrooms need to be risk assessed. However, this does not mean a long, you know, cumbersome process that has to take place. So in reality, all teachers are constantly assessing risks, okay, which when deciding which activities to undertake with pupils and adapt activities to this, you know, to the specific child. So, for example, I'm a drama teacher. So I'm working in the classroom, a child goes on the chair. The first thing I say, can you get off the chair, please? Okay, get off the chair. I don't want any of my, I say that to my students, I don't want anyone standing on chairs at all. It's a different way of doing it. I can use, you know, set, I can, you know, control it. And actually when I'm teaching, I'm actually, you know, talking to children about risk assessment, how we control risks and hazards within theatre, etc. You know, I actually build that into my practice. So in reality, as I said, all teachers are constantly assessing risks when deciding which activities to undertake with pupils and adapt activities to the specifics of the pupils. And that's why, like, individual pupil risk assessments are really important to adapt practice and procedure. So most of the time, risk assessments do not need to be written down, especially where there are for activities that are, you know, inherently low risk. So in certain circumstances, however, risk assessment should be recorded. This is usually where there is a specific and significant risk. I mean, this will you know, mainly apply in practical subjects. So whether to record the risk assessment is a professional judgment, but bear in mind that it is the teacher that is responsible for the activities, and they would know the process. Okay. Next one, please. So example, touch surfaces. So in this final section, I just want to look at risk assessments processes through specific issues in the COVID-19 outbreak. Okay, so next slide, please. Okay, so we're looking at touch surfaces. So what are the hazards there? You can see on the slide. Touch surfaces become contaminated by the virus. Who might be harmed or how? What you are already doing? Do you need to do anything else to control this risks? Action to be by who? Action by when, and done. So you've got an example there of a specific risk assessment document. So a specific issue in the risk assessment process around limiting transmission of the virus in schools or college will be dealing with the touch surfaces. So I've used this as an example. The hazards of the surface that becomes contaminated with the virus, and it has the potential to transmit disease. It has a high likelihood and severity and potentially impacts on all. So what control measures can be put in place? So following the hierarchy, are there any tasks that you do not need to be done? Anything that unnecessarily moves people around the building, increases the risk of contamination or by touch surfaces? So the first thing would be to stop unnecessary movements. Soft furnishings and toys are difficult to disinfect and should be removed where possible. So can the process be changed? If doors are usually closed, can they be safely left open to avoid touching them? Okay, bearing in mind fire precautions. Remember, there is little point in removing one hazard if it causes another. And that was an issue that I picked up in schools where fire doors were being left open. We took advice from the fire service and we amended the risk assessment and putting the control measures in because, you know, we looked at the hierarchy of risk. So can safeguards be put in place? Can we keep pupils to the same desk? Can we increase the cleaning so the surfaces are regularly disinfected, and so on? So should personal protective equipment be issued? I mean, this is the last resort, but, you know, masks, I mean, I think the last bit of training that you've just had talked about having masks and teachers wearing masks and pupils wearing masks to stop the potential spread of the virus. So these are some of the things that should be considered. Okay, next slide, please. So health and safety reps, we're nearly there now. So appointed by the and act on behalf of NASUWT members in a workplace, legally defined and protected, trained, no additional responsibility. So throughout this guidance, reinforce references being made to the health and safety rep, and a health and safety rep is appointed by the members, so they need to be elected in a workplace to act on their behalf of health and safety matters. I would always say with it when you're elected, whether they would formally write, I would always say to the employer, it would be the chair of governors, or it could be the authority, just to inform them that that individual has been elected. Or, you know, as I say, if that responsibility is delegated down onto the head teacher, I would formalize it, you know, in an email just to say that the due process has taken place. I say that just in case that individual needs to go out on training and is to decline the training. You could always then track it back to the, and it supports any conversations that we need to have with the employer. The role is defined in the safety reps and safety committees regulations, which states that, amongst other things, that health and safety reps must be given appropriate time off with pay to carry out their role. This will include undertaking health and safety inspections and attending the health and safety committee. The NASUWT offers free training for the health and safety reps, which employers must give paid time off for you to attend. You know, it's also about being reasonable with the employer and giving them enough time, you know, in advance in terms of when the training is. But what we're trying to do, again, with the 74 Act is about enabling, working together, creating that culture where it's supportive. Although the health and safety reps, representatives do have extra powers, there is no additional responsibility. And I think that's really important. You're not legally responsible in that school as a rep. That goes back to the responsibility of the employer. Okay, so if your school or college does not have a health and safety rep, why not become one? I did. I became one, and I've been doing the job for 20 years now. And you know, we've changed the culture within our organisation. We've worked really, really hard. And, you know, our safety is really, really good. And our chair of governance is absolutely thrilled about it. And our retention figures are very, very positive on things like stress, for example. That's one of the things we've worked really, really hard on. Okay, slide, please. NASUWT, further guidance, NASUWT website, government advice, HSENI or HSE. I would say that the NASUWT website is excellent. You know, have a look on that. But also the Health and Safety Executive has some really, really positive information. So the other thing I would also mention is the Valued Workers Scheme. The Valued Workers Scheme is an opportunity for you to use the scheme to work as an incentive to work with employers. So that the Valued Workers Scheme is on the website. Have a look at it. if you've any questions about it, then if you go through Wayne, I'm sure that we can organise some form of training about it. I mean, if I could be of assistance to do anything on that, then I'm more than happy to maybe do a short presentation on that if required. So I hope you found it interesting. And what we'd like to do now is just take some questions. Thank you.
That's lovely, Jeff. Thank you very much. There are no questions in the question box at the minute, but I'd like to extend on Raymond Beggs's question from the previous section, which was in relation to large gatherings in school halls for examinations and also parent-teacher consultations. We're getting messages daily into the office in relation to this, where principals are advising the staff that they have the relevant risk assessments completed. However, with the guidance in Northern Ireland changing this week from the government, teachers are very anxious about going into large gatherings, and we were wondering what advice would you give to staff on that at the minute?
I'm not going to, I think it was because of that changing guidance, it might be helpful for Wayne just to initially offer some feedback, and I'm also more than happy to add.
Yeah, I mean, to me, it comes down to, as Jeff said, the hierarchy of controls. So any event needs to be risk assessed. And the first thing you do is ask yourself, is this necessary? Is this necessary at this point in time? Can we do it a different way? And if we can, then we should. So in the case of, let's say, the parents' evenings, there's absolutely no reason why they couldn't go online. So that is a reasonably practicable thing to do. With regard to assessments, do they need to be done now? Can they be done in a different way? Can the groups be split up to increase the distancing? Can we use different ways to make sure the rooms are ventilated? So it really does come down to what the risk assessment says, and that should be the subject of consultation. I think
I totally get with Wayne. I mean, I don't understand what the issue is around parents' evening. We've got the technology now. The thing is we use the technology to teach children for over a year. The technology is very, very good, and actually it brings in other things. I think the feedback I've had is that parents actually like it because they don't have to travel. They can stay. If they've got caring responsibilities, you've got to see it as a positive. Not just on a health and safety, but look at the welfare aspect of the 74 Act. This is an opportunity to look at equality and making reasonable adjustment. So I do think this is we've done it at my school, and it's worked really, really well, really well. I think also information evenings, like in year 9, I mean, videos can be made of the information for each department. It doesn't take very, very long to do that, and captures, what people do at GCSE or, we use Loom as well in terms of doing short videos for parents. Technology is there. Go back to the hierarchy of control. There are ways and means of doing it. And in terms of, as I say, with exams, there's opportunities of doing exams. There's ways and means of doing that where you don't have to get large groups of people together to be able to do it. It's about finding a sensible solution and consulting. It's consulting with the staff and asking their advice and their ideas. Okay, thank you.
Brilliant. Thank you so much.